Hi there. Thank you all for having me today. I'm Jenny Moye. I'm a third-year resident at Brown University, and thank you all for having me on behalf of our team. We're excited to share a little bit of our work on hidradenitis suppurativa with you all. Today I'll be talking about the hidradenitis suppurativa screening tool, or the HST, as well as the HST pilot validation study. So just to go over a little background on hidradenitis suppurativa, hidradenitis suppurativa is a folliculocentric chronic inflammatory condition which results in scarring, pain, and diminished quality of life for those who are affected. In particular, the mean dermatology life quality index score is higher in patients with hidradenitis suppurativa than in patients with other dermatologic conditions, including psoriasis, rosacea, and bullous pemphigoid. Which means that patients with hidradenitis suppurativa have a more significant reduction in quality of life, both physically and mentally, compared to these other patients. Hidradenitis suppurativa is characterized by skin lesions, including recurrent nodules, abscesses, and sinus tracts, and these characteristically affect the axillary, inguinal, gluteal, and inframammary skin folds. And you can see here as well that there can be a great deal of variation in severity for individual patients. We know that diagnosis and treatment are frequently delayed in patients with hidradenitis suppurativa. Sante et al. In 2015 showed a diagnostic delay for hidradenitis suppurativa of 7.2 years compared with just 1.6 years for patients with psoriasis. We also know that the incidence and prevalence of hidradenitis suppurativa are unverified given the paucity of large cohort studies, and estimates range from 0.33% to 4% depending on the study population. In addition to the burden of disease caused by skin lesions, studies have also shown a link between hidradenitis suppurativa and numerous other comorbidities, including metabolic syndrome, smoking, arthropathies, psychiatric disorders, polycystic ovarian syndrome, and inflammatory bowel disease. And as of right now, there's no validated screening tool available to aid in the diagnosis of hidradenitis suppurativa. So the purpose of this project was to develop and validate a screening tool for hidradenitis suppurativa with the primary goal of enabling simply early identification of affected individuals. In order to do this, we performed an extensive literature review and also used the Delphi method to identify key features in early diagnosis of hidradenitis suppurativa. We then compiled the key features into a patient-friendly survey in an easy-to-administer format. The hidradenitis suppurativa screening tool includes a series of photographs of characteristic lesion types, including pimples, boils, scarring, and draining sinuses, and also asks patients about key locations, including armpits, breasts, groin, and buttocks. Additionally, it includes questions about treatments, history of severe acne, pain, and frequency of flares. We performed a pilot validation study by administering the HST to 15 patients with known hidradenitis suppurativa, as well as a control group of 15 patients without hidradenitis suppurativa. Patients with HS were recruited from patients seen in our clinic with a known diagnosis, and then for the control group, we recruited general dermatology patients seen in our clinics for other issues, such as skin cancer and other inflammatory conditions. Here you can see that in terms of age and gender, the hidradenitis suppurativa and control groups were fairly similar, with a median age of 41.3 for the HS group and a median age of 43.6 for the control group. The HS group included 11 females and 4 males, while the control group included 10 females and 5 males. The median age at diagnosis for the hidradenitis suppurativa group was 33.7 years old. And then with regards to prior diagnosis of hidradenitis suppurativa, 86.7% of participants reported prior diagnosis by a dermatologist. 53.3% reported diagnosis by a non-dermatologist medical doctor, and 20% reported prior diagnosis by either a nurse practitioner or a physician's assistant. Of all of the screening questions included in the HST, history of acne was the only question that did not statistically significantly differentiate between patients with HS and control group participants. Overall, 60% of HS patients and 46.7% of control group participants reported a history of pimples. In contrast, all other questions differentiated between the two groups with a p-value less than or equal to 0.017. 93.3% of HS patients reported a history of boils, compared to only 6.7% of control group patients. 86.7% of patients with HS reported scarring, compared to none of the control group patients. And 93.3% of the HS group reported areas that leaked pus or fluid, compared to none of the control group participants. Looking a little lower, you can also see a similar trend with regards to location, with 40 to 80% of patients with hidradenitis suppurativa reporting lesions in characteristic areas of the axillae, breasts, groin, and buttocks, compared to only 0 to 6.7% of control group participants. With regards to outbreaks and flares, 93.3% of patients with hidradenitis suppurativa reported 2 or more outbreaks of their condition in the last 6 months, compared to 20% of control group patients. All patients with hidradenitis suppurativa reported scarring at the location of outbreaks, compared to 6.7% of control group participants. Severe acne of the face, chest, or back was reported in 26.7% of patients with HS, compared to 6.7% of control group participants. However, this difference was not statistically significant in our pilot study. Finally, patients with hidradenitis suppurativa reported a median pain from their condition of 8 on a scale from 1 to 10, with an interquartile range of 5 to 10, compared to control participants who reported a median pain from their condition of 0, with an interquartile range from 0 to 2. You can also see here the prior treatments reported by patients with a history of hidradenitis suppurativa. The most commonly reported treatments included topical and oral antibiotics by 26% of participants, followed by topical antibiotics only or antibiotics and surgery reported by 20% of participants. 6.7% of participants reported a history of treatment with oral antibiotics only, a combination of antibiotics and oral steroids, a combination of antibiotics, oral steroids, and surgery, or isotretinoin and antibiotics. We also included in the treatment section questions about use of adalimumab, infliximab, etanercept, CO2 laser, ND-YAG laser, and spironolactone, but no patients in the pilot study reported these treatments. So in summary, the HST shows promise as a simple and effective screening tool for early diagnosis of hidradenitis suppurativa. We're currently working to determine the sensitivity, specificity, and predictive value of different components of the survey, and will then proceed to larger validation studies. We are hopeful that establishing this self-administered screening tool will enable a very simple early identification of hidradenitis suppurativa with an end goal of preventing scarring, reducing comorbidities, and enhancing overall quality of life for individuals with this disease. So I'd like to acknowledge Dr. Soyan Peck, as well as Dr. Abrar Qureshi, lead researchers on this project. They've been integral in designing the tool and carrying out the pilot validation study. I would also like to extend a special thanks to Kimberly Marcolivio, who prepared the IRB for us, and a huge thanks to the American Acne and Rosacea Society for having us here today. This is our reference list, and thank you to Visual DX for the photos. Please feel free to email with any comments or questions after this as well at virginia_moye@brown.edu, and I will be at the poster session tomorrow morning in Exhibit Hall A from 10:15 to 12:15 if you have any other questions at that time as well. Thank you very much.
Any questions? So I had a question about, so how many, are you going to still be reducing the number of items in your tool, or what's your thought for the next steps there?
So as of right now, we're not necessarily planning to reduce the number of questions. The tool, it fits on one sheet of paper. It's very user-friendly and very easy for patients to take. Certainly not all of the questions are critically important in terms of making the diagnosis of hidradenitis suppurativa, but the goal is also to gather some useful information for research and for us as clinicians as part of the tool. So right now the plan is to keep everything in place, but we are looking at determining sensitivity, specificity, and predictive value to better differentiate between other similar conditions like folliculitis and recurrent abscesses when using the screening tool.
Great. Thank you.
you.